We're going to move on now to rehab centers. If you want to be able to get a list of rehab centers within your area, this is something that you can literally look up online. Use Google. It's an amazing tool. It's a free tool to be able to help you literally make money. It's a money-making tool because it does the research for you, or it finds people that can do the research for you. So if you want an easy Excel list, I would suggest you can use one of the list building companies to be able to obtain that. It depends on what state you are in. Some states you can go in the Department of Public Health website and to be able to look up the information which has it all there for you. You can also ask your current physicians to see what rehab centers they're currently working in. Now, just like the physicians, we truly suggest that you provide educational-based marketing materials for them. Just like the same sheets that I explained to you guys with the physicians that will have a decision tree or a questionnaire for the patient, you can use that as well to give to the potential referral sources. Now, in the rehab centers, go look for the social worker or the discharge planner. Very, very good place to be able to offer them that. And it's the same thing. Go ahead and save them time because time is money. How can you save them time? Same thing. You will handle all the necessary items that a home health agency should be doing that sometimes their staff are actually doing, and not knowing that if they contact you and your team, that you can actually provide those services. Okay, nursing homes. So where do you find lists of nursing homes in your area? One great source is Medicare.gov. You can literally do a search under looking for nursing homes, and you should be able to find a list within your area by looking up your county or looking it up by city, or just writing where your company is at and to choose a list. And what's going to happen is it's going to generate a list of what's around your particular area. So how many nursing homes are in your area? Do you know this by now? If you don't, start looking it up. And the reason why that is, these are gold mines when it comes to referrals, whether it's home health services or non-medical. You definitely want to be able to work with them. Now, if you're non-medical and you're marketing to the physicians, to the nursing homes, to the rehab centers, you can also share with them the benefits of what home care can do for the patients. So remember, you just want to keep on educating them. So once you know how many nursing homes in our area, you can determine how you're going to market to them. You should be able to create a marketing plan. Now, if you are not able to put one together, we will help you create and generate an amazing marketing plan on how to target all these physicians in your area, how to be able to properly distribute time and effort to these nursing homes. It's a very good tool that's going to be able to help you succeed. The next thing is you should know who the administrators are once you find out these places. So this is where cold calling is very important on how to get these. And we will discuss cold calling in another video. So once you find out who the administrators are, because it is important, understand that most of the time the administrators are not really the ones that are discharging the patients or choosing a home health services. What you can do, you can use the administrator's name and also segue yourself to be introduced to the discharge planner or to the social worker. So ultimately, those two are the ones that's going to be able to have to call you when there is a potential referral. You have to first gather information. You never go into any facility, any marketing campaign without gathering information first. So you should always compile a list of all the nursing homes, of all the physicians, of all the rehab centers, and write down who are the social workers, who are the administrators, who are the director of nursing. Because when we create a marketing campaign, you're not just going to go in there cold. You're also going to go in there by sending emails, sending mail, sending faxes. All of those are very important for you. So you want to know who the big players are. And with the physicians, you also want to find out who their office managers are, who are the nurses, who are the phlebotomists, who are the receptionists. Very good information to have. Like I said, know the administrators, know the DONs. For you guys out there who don't know what a DON is, that's your director of nursing. Who are the social workers? They're also known as sometimes as the discharge planners. Who are the receptionists? These are very important information to have. Why also the receptionists? Well, most of the time, these are what we call the gatekeepers. And there are ways on how to be able to go past the gatekeepers, which is very important.